Celo is an app that's been developed to allow us to capture images of patients and do that in a secure way, do that in a way where we know that image is of a particular patient, gain their consent, and then if we need to, share those images with other clinicians as part of looking after that patient. I go to the Chatham Islands twice a year to see paediatric patients over there, and one of my patients was also a patient in the plastic surgery service here. He'd come over to Christchurch and had a revision of a scar on his neck. When I saw him, his mum told me that they were booked in to fly back from the Chathams to New Zealand to have that scar seen in the plastic surgical clinic. That involves 2 airfares, one for him and one for one of his parents, that the DHB funds. But more importantly, it involves usually 3 or 4 days of time off work for parents, time off school for the child, and accommodation in Christchurch. So what I was able to do with Celo is take a picture of his scar, send it straight to the plastic surgeon he was going to see, and within 5 minutes have her let me know that the scar looked fine and he didn't need to come to his appointment in Christchurch. So we'd used Celo a lot within the DHB, and so an example of that is when I'm on call, it might be in the evening and I'm at home, one of the registrars wants to ask me for advice about a patient who might have a rash, for example. So now they can send me a picture of the rash as well as talking to me about the clinical presentation of the patient, and I find it much easier to give them good advice about what to do. We're also not just sending images, but it's a way that we can message each other securely about patients, and what we're really looking forward to is a way for the images that we capture and the messages we send to then end up in the patient record so that they're permanently available for us.